Okay, welcome to the November 9th version of the Town Council meeting, the Town of Morristown. Welcome all. Margot, take it away.
I, Margot GK, the Town Clerk of the Town of Morristown, do hereby state that it is 7:31 p.m. on Tuesday, November 9th, 2021, and that this regular meeting is being held remotely via webinar. Both adequate and electronic notice of this meeting were provided according to law by written notice to the Morristown Daily Record, the official newspaper of the Town of Morristown, and to the Newark Star Ledger, both more than 48 hours ago. Notice was also posted in Town Hall and on the town website and filed with the office of the Town Clerk of the Town of Morristown. I do further state that I shall enter into the minutes of this meeting a statement that such notice was furnished as particularly described by me in this public announcement. Roll call. Councilwoman Cotton.
Present.
Councilman Elms is excused this evening. We do expect Councilwoman Foster shortly. Councilman Iannacone.
Here.
Councilwoman Mayer.
Here.
Councilman Silva.
Present.
Council President Armington.
Here.
Mr. President, you do have a quorum.
Thank you. We'll move into a moment of silence. Followed by the Pledge of Allegiance. The Pledge of Allegiance
Allegiance to the flag
to the flag
of the United
of the United
States
States
of America,
and to the
and
Republic
to the republic
for which
which
it stands,
stands
one
one
one nation
under God,
under God,
indivisible,
indivisible,
with
with
liberty
liberty
and
and justice for all.
Thank you very much.
Before we get started this evening, there is one change I'd like to announce in Ordinance O-33-2021, subsection E, terms of license and license renewals. Items 2 and 3 were accidentally duplicated. So number 3 under section E will be deleted. 4, 5, 6, and 7 are hereby renumbered as 3, 4, 5, and 6. There are no items on the consent agenda, so go straight into the public hearing. At this time, I'll open the floor for a public hearing on any matter. Please raise your hand in the Zoom app to indicate that you would like to speak. If you've joined the meeting via telephone, press star 9. When it is your turn, the moderator will send a signal through the app and ask that you unmute yourself so that you may be heard. To unmute yourself on your phone, press star 6. At that time, kindly state your name and address and limit your comments to 3 minutes or less. Be advised that any derogatory comments targeting members of council and or administration may be ruled out of order. No comments were received via email.
Council President, the first public speaker is Lorena Inestroza. Ms. Inestroza, if you would unmute yourself and state your name and address for the record, please.
Thank you, Lorena Inestroza, 39 Early Street, Morristown. I just have a few quick comments and questions. The first one is I really didn't follow the 1776 whole proposal application deal, but I do have a concern. I was uptown Friday night, and I noticed that they're using like a quarter of the lane on 202 North for parking. And I've also noticed that the valet service, when they're coming out of headquarters, there's no left turn allowed. I watched a valet employee make a left turn. Not only did he make a left turn, when he hit that little triangular piece that separates one way and then heading onto North Park Place, made a U-turn and parked the car on the side of the road. And I think, I don't know if there's going to be oversight on that or if they're going to keep an eye out, because I think that's pretty much a safety hazard. My second comment is I noticed on the agenda or upcoming agenda for either medical marijuana dispensary or marijuana dispensary, I noticed the lineup of the committees, and I was just wondering why or if they entertain the thought of including maybe somebody other than a salaried or stipend employee from the town of Morristown be on that committee, such as a doctor who has prescribed medical marijuana in the past or has experience with it. Could somebody tell me why it was just limited to town or stipend employees of the town? And my third question is, I don't know, maybe Jillian can answer that. Can you tell me if a requirement for DPW to be an employee in the town of Morristown is required to have a valid driver's license? And that's it. That's all I have right now.
Thank you, Ms. Enestrosa.
Council President, I don't see any other hands raised for public comment.
Okay, we will close the public hearing. Moving into council responses to public hearing comments. I'd like to start off addressing Ms. Enestrosa's comments. Can we, Jillian, can we check with the parking authority to see if, I assume that 1776 has approval for the use of the curb lane for valet parking. I assume that must have been part of the site plan approval. Can we have someone look into that just to make sure that that is legitimate?
Councilman, I'm intimately knowledgeable about the valet service as I've been working with the restaurant owner to address a couple of concerns that have been raised. You know, as the restaurant has been opened for the last few weeks, we've been working to try to work out some of the issues. I apologize for the noise in the background. There's a lay-by lane that was created by the property owner at 1776 that is on their private property. Was created, and the approval was for pickup and drop off, and it was also intended to be used by potential valet service. So that is consistent with the site plan approval. However, the concern about the legal U-turns, I will make sure the police department looks into it and monitors to make sure that the valet services attendees are not creating a safety hazard on Speedwell Avenue.
Thank you, Jillian. As far as Ms. Enestrosa's comment about the proposed ordinance and the committee is intended to review applications relative to the stated criteria in the application process. It is not to consider whether one or another prospective licensed applicant is right. It's whether or not they meet the qualifications. So you know, I had some other comments from other council members about the possibility of including teachers or church recipients, church leaders and others, or doctors on the committee. It's not a qualifying. I don't know how to say this. Essentially, it's reviewing the application relative to the criteria and agreeing on the merits of the application, specifically as it relates to what is in their application. There's no qualitative assessment of from a religious person's perspective. This person, you know, this applicant is better suited than another. You know, from the education's perspective, if you know, if the ordinance passes, then the ability to apply for an application is as of right in the town, and we don't want people using outside. I don't know what I'm saying. Well,
I might, Stefan.
Well, go ahead.
It's actually interesting. You know, the ordinance, Lorenza, actually is a zoning ordinance that you're seeing tonight. And all administration is doing is looking at the compliance of the operation, compliance of the application as it applies to the zoning and some of the rules and regulations that we put in place with reference to the operations of the cannabis store. I think what your concern is more of an issue with the state, because the state is actually issuing the license. And the license is actually the medical and the other concerns that I think you're concerned about. And so the state is reviewing exactly what you're talking about. And it does have those people on those review committees that are reviewing those applications. So I think that our authority was over the scope of the operation and the zoning of the operation, the medical, the competency, and those and the like of your very good, valid concerns are actually handled by the state in the licensing process.
Well said, Bob.
Excuse me, if I may just announce that Councilwoman Foster has joined the meeting at 7:41.
Welcome, Ms. Foster.
So I'm sure that when we go onto the resolution 33, we will speak more about it, right?
Yes,
Okay.
we'll have the ability to, we'll make a motion to introduce it. We'll get a second. We'll open it up for comments from council. Then we'll vote on it to introduce, and then it'll go to the planning board for a consistency determination with the master plan. And then assuming it passes that, then it'll come back to the council likely in December for a full public hearing and further discussion by council members. So that is the intended process. If there's no other responses to Mr. Mastroza's comments, we'll move on to Mayor's proclamations and presentations. Mayor Doherty is out currently on a medical issue, getting a doctor's appointment. So he asked me to read the proclamation designated November 2021 as World Pancreatic Cancer Month. Do we have anyone in attendance?
Yes, Todd Cohen is in attendance representing the pancreatic cancer.
Okay, so Todd, I'll read the proclamation on behalf of the mayor, and then if you'd like to sign in and provide some comments, we'd appreciate that. This is a proclamation. Whereas the American Cancer Society's estimates that about 60,430 people in the United States will be diagnosed with pancreatic cancer in 2021, and 48,220 people will die from the disease. And whereas pancreatic cancer is one of the deadliest cancers, is currently the third leading cause of cancer death in the United States, and is projected to become the second leading cause within the next 5 years. And whereas pancreatic cancer has the lowest survival rate among all cancers, with a 5-year relative survival rate of just 10%, and accounts for about 7% of all cancer deaths. And whereas when symptoms of pancreatic cancer present themselves, it is generally in later stages, and only 10% of pancreatic cancer patients are diagnosed when the disease is confined to their pancreas, and 90% of pancreatic cancer patients die within the first 5 years. And whereas pancreatic cancer is the 7th most common cause of cancer-related death across the world, and approximately 1,360 pancreatic cancer deaths will occur in New Jersey in 2021. And whereas there will be more than an estimated 500 million new pancreatic cancer cases diagnosed worldwide in 2025, a yearly increase of 3%. And whereas the good health and well-being of the residents of Morristown are enhanced as a direct result of increased awareness about pancreatic cancer and research into early detection, causes, and effective treatments. Now, therefore, I, Stephen Armington, Council President, on behalf of Timothy P. Doherty, Mayor of the town of Morristown, do proclaim November 2021 as World Pancreatic Cancer Month in the town of Morristown. And this is signed by Timothy B. Doherty, Mayor of the town of Morristown. So Todd, if you can come up, and we'd appreciate any words you have to share.
Can you hear me?
Yep.
Okay. Council President Armington, I really appreciate it. Thank you so much for presenting the proclamation. I hope everything is okay with the mayor. I just wanted to address you. I know we've been doing this for a number of years now, and I thank everyone at the township for marking November as Pancreatic Cancer Awareness Month. So I am a volunteer for the Pancreatic Cancer Action Network. It's a national organization that creates hope in a very comprehensive way through patient support, community outreach, and advocating for a cure. Back in 2002, I lost my father, Richard Cohen, to pancreatic cancer. Not much really has changed except the rising statistics about the disease. So back then, the survival rate was about 5%. We're up to about 10%, so we're making some progress, but the number of individuals are increasing. So you just mentioned there's over 60,000 individuals that are expected to be diagnosed this year. There aren't many good tools right now to battle this disease. That's why the survival rate is still in the low double digits. So what I'm looking to do is raise awareness for this insidious disease. November 18th is World Pancreatic Cancer Day. So I encourage everyone to wear purple. You'll see on the newscast people wearing purple. And if you know somebody who is affected by pancreatic cancer, I encourage them to go to pancan.org, PANCAN.org, to learn more about pancreatic cancer, as well as the free resources that are offered. We do have a walk that's scheduled in Parsippany. That's April 30th of 2022. So we're looking to raise money to combat this disease and hopefully increase the survival rate and find a cure and even an early detection method. When my father fought this disease, there was no blood test. There was no really early detection method. And that's still the case. So we're looking to change the path of this disease. Before I go, I just want to thank the Township Council for your important contribution in this fight against pancreatic cancer. And a special thank you to Kristen Wedderburn, who helped set this up, as well as Margot. I truly appreciate it. And, I want to thank you for supporting our cause and helping wage hope by raising awareness about pancreatic cancer. Thank you so much.
Thank you, Todd.
Okay, so
All right,
Continuing
well, sorry. Report of mayor and town officials.
Okay, so in the mayor's absence, I will go over a few calendar items and general information. The first is COVID is still with us, so sharing COVID information and vaccinations and ages 5 and up and for testing information, please visit www.townofmorristown.org/COVID-19. Homebound residents can call 973-451-4121 or our office at 973-292-6626, and we'll help any resident who is homebound that still needs a vaccination to make sure that they get their inoculation. For vaccination appointments, you can also visit atlantichealth.org, shoprite.com, cvs.com, or covid19.nj.gov for further information as to where anyone can go to get a COVID vaccine. Town Hall will be closed this Thursday, November 11th, in commemoration of Veterans Day. The ceremony at the Green for Veterans Day will be at 11 a.m. And then Friday, November 19th, which is next week, from 1 to 2:30 p.m. is a Thanksgiving food distribution event via the Table of Hope at the County College of Morris. That's at 214 Center Grove Road and Randolph in parking lot 1. Lastly, I'd like to remind all of our residents that it's now leaf season. You may rake your leaves to the curb for leaf collection. And for more information about our leaf collection schedule, you can visit www.townofmorristown.org/recycle. The pickup dates by ward: Mondays is Ward 1, Tuesdays is Ward 2, Wednesdays is Ward 3, Thursdays is Ward 4, and Friday leaf pickups will be townwide for any areas not collected. We do ask that no brush, rocks, dirt, limbs, twigs, or hedge clippings be mixed in with the leaves. These items will damage our leaf vacuums, which are very, very costly to repair. And also a reminder that leaves should not be placed into bags. It's a short list today, Councilman. That's all I have for today.
Thank you, Jillian.
Thank you.
Moving on to council liaison reports.
MHA. MHA received approval last Thursday at the HMFA board meeting to release the tax credits to MHA begin the RAT on our senior buildings. Those are great news. The relocation team that was contracted is called Housing Opportunities Unlimited, and it will begin working with the seniors to manage the RAT transition. This process will go over the next 2 months because it's a long process and it has a lot of steps and details, especially to plan and relocate the seniors. That's one thing. The second thing is that 90 seniors received the COVID booster shot last week. That's all from me.
Thank you, David.
The partnership does not actually meet till tomorrow morning. However, just a couple of reminders. The Festival on the Green, the holiday celebration on the Green, they've been working hard on it with the trustees of the Morristown Green, who actually controls the Green. And there's various events. You can go to the website, take a look at the events, particularly from November 27th through December 18th. A lot of nice things going on the Green. Sponsored by the partnership with the help of the trustees of the Morristown Green. Also, just a reminder that the gift card program is on the website, also at the Morristown Partnership. It makes for a nice gift, especially last minute gifts. The other thing that the partnership's working on, I think there's going to be more discussion on it tomorrow, that the town should be interested in, is they are in the process of assisting the businesses in 2 areas. One, to get some additional support of additional funds that are available for businesses that have suffered during COVID. And secondly, they're working hard on assisting the businesses with the new regulations from the state concerning the use of straws and plastic bags. So there will be changes with reference to straws and plastic bags over the next 6 or 7 months. And it's going to be all our job to cooperate with their changes. Thank you, Steph.
Shade Tree. First, I'd like to thank Council President Armington. He recently met with Shade Tree Commission to help work on the divining of the Elliott Street Park. So we're very grateful for everybody's participation. The next bit of news is just really happy. The Jersey Cottage Park, the tree planting is started happening today, and it's going to continue for the next few days. I just really want to mention this, that Councilwoman Cotton came to the Shade Tree Committee and said the Jersey Cottage Park, she had a lot of complaints from her constituents. She addressed the issue with the Shade Tree Commission, with the administration, with the mayor, and with all of us working together with DPW. The Shade Tree Commission got a grant, $2,500 to pay for new planting in that park. So when we all work together, we can get a lot accomplished. And it really started out with Councilwoman Cotton just letting us know that people were unhappy with the way the park looked. And the mayor and the administration, Mayor Doherty went out there himself, and he went out with DPW to point out all the areas that needed to be cleaned up, because there was a lot of brush that was inviting nefarious activity to happen in that park. Everything's being cleaned up. It's just a great effort from everybody. There's going to be a new bench placed next spring once the ground, we could put a concrete slab in there, and everybody's just working together. So thank you to the STC, the administration, the mayor, and Councilwoman Cotton for that.
Kudos. All right. If there's nothing else, anyone else have anything to add? No? Okay.
Sorry, I was on mute. My apologies. I didn't. I missed the moment of silence, and so if I may, at this moment, just ask that we remember Linda Murphy and her family, and if I may, Council President, just read something that I received on her behalf regarding the viewing in her services.
Sure.
It is with great sorrow that we announce the passing of Linda D. Murphy of Morristown, New Jersey. Linda was an outstanding leader of the community, recognized for decades of service to the Morris School District, as well as a devout member of Calvary Baptist Church of Morristown. The public viewing will be from 3 to 7 p.m. on Sunday, November 14th. Additional viewing is from 10 to 11 a.m. on Monday, November 15th, with funeral services following thereafter. All services will be held at Calvary Baptist Church, 10 Martin Luther King Avenue, Morristown, New Jersey. Masks are required as per location protocol. We invite you to send your messages, prayers, photos, and memories to Dear Miss Linda Murphy at gmail.com. That's Dear MS LINDAMURPHY at gmail.com. If we can all do our part in help pass this information along, share it on social medias, and I'm sure we can get Kristen to post something, on the town website or Facebook. That would be greatly appreciated. So I just ask at this time that we all keep Linda Murphy and her family in our prayers. Thank you, Council President.
Thank you, Toshiba. Okay, moving on to regular business.
Excuse me, there are two ordinances for introduction this evening. Ordinance number O-32-2021, an ordinance of the town of Morristown and the county of Morris, state of New Jersey, amending ordinance O-18-2017, establishing compensation for management/non-union positions in the town of Morristown, New Jersey, and amending all ordinances concerning such compensation heretofore adopted.
I'll make a motion to introduce ordinance number O-32-2021.
I'll second.
Comments, questions from council? I have a question. So I understand this adds a public health officer and a health educator to the ordinance, and it's in response to I guess primarily the county reaching out to the town and saying that they no longer wish to participate in shared services with the town for providing the public health officer. Can you, Jillian, I think we're aware of what the salary ranges are for these. Can you share with us what the cost of the shared services was with the county for the services they provided?
I believe the contract was about $165,000 a year, which provided a part-time public health officer, part-time public health educator, and some health inspection support, which is the REHS position, the registered environmental health specialist, which is a health inspector. So they provided support in addition to our existing staff to provide inspection services. And then they also supplemented with our public health nurse once we had a vacancy, which occurred earlier this year. I think, the feeling, quite frankly, I think is mutual. I believe that this pandemic, has made it clear how important public health services are, particularly at the local level. And I think that our town would be much better served by having our own full-time staff, particularly a public health officer who can really focus on our local residents and provide, not only sort of direct public health services, but can really help us think strategically about making sure that our community is getting the kinds of services that we need, is seeking grant dollars for public health services. And then the public health educator position, in a similar fashion. the public health educator position is required by the state statute, as is the public health officer position. And I'm eager to get that process going to have to reconstitute our local public health functions within our town.
Now, Stefan, originally I was a little concerned about this because I actually think that this is an ideal service that should be a shared service. You know, the scope of public health is constantly broadening and it's extremely complex. I think what COVID did teach us is the public reporting, the public tracking, the speed of information, and the complexity of information is such that I think this is a service that is ideal for shared services. Unfortunately, and I'm going to criticize the county, I do not understand why the county, and I know other towns have shared services amongst themselves with other towns, but this is an area that the county should be stepping up and beefing that service along with other healthcare providers in the county. And in this instance, I think Jillian's right. We have no choice but to do this now. But I understand the need for it to be local, but you know, I deal with this every day. And I think the complexity of this, I think what we should be doing is encouraging the county and other municipalities to start taking public health, and I'm not talking restaurant inspections and the like of that right now, but public health concerns and the equity of the access to public health a little bit more seriously. And we should be actually putting some force to the county to basically take a look at this.
Thank you, Bob. One other question, Jillian. I recall when this issue first came up, you expressed that the township was not interested in sharing services, but you had expressed that other municipalities, Madison or some others, were interested potentially in considering shared services with us if we were able to get a public health officer. Is that something that has been advancing or?
As I mentioned to you, there's been some preliminary discussions with a few other municipalities who may be interested in working with us once we were able to reconstitute our public health functions. But I think we need to get that part going first before we can advance that conversation. So, you know, as I mentioned before, I'm eager to get this going. I've had some preliminary conversations with some candidates who I think might be a good fit. And hopefully we can get this, you know, put together, you know, fairly quickly. And then we can start to look at ways that we can work with some of our neighboring communities. It's a tough area. There's not a lot of public health officers, licensed public health officers out there, like many other licensed positions. And I, in fairness to the county, though, you know, Councilman Iannacone, I wholeheartedly agree in many respects that, you know, I think there should be more of an emphasis on a regional and countywide level on public health, not just the inspections, but on everything. You know, I think there's been a lot of disinvestment in public health over the last, you know, many years at really all levels of government, that now I think everybody has seen, you know, how short-sighted that those decisions have been. And so we're all sort of playing catch up. And I think the county has been overwhelmed, you know, with, you know, limited resources. You know, Morristown is very busy. You know, COVID sort of just added another layer of complexity. But it's, if any time is a time to implore the powers that be to really consider investing in public health, you know, financially, as well as sort of, you know, human resources, this obviously is the time. But in the meantime, you know, we have to be concerned about our residents, and so, you know, we're going to have to move forward.
I have a question. Once we implement this and we hire these new employees, will they also work with the county on data or any other matter related with health, or they have to work just by themselves?
So there is a county epidemiologist that just started a few weeks ago. I would expect that we would still have access to some county level health resources, but we would have direct access to the databases for, like, for example, the COVID numbers and the other sort of communicable disease databases, and we would be able to track some of that data on a local level directly with our own staff as well. But I'm hoping that we will continue to be able to leverage the resources of the county as well.
If there's no other comments, call the question, please, Margot.
Okay. On the introduction of ordinance O-32-2021, Councilwoman Cotton,
Yes.
Councilman Foster,
Yes.
Councilman Iannacone,
Yes.
Councilman Mayer,
Yes.
Councilman Silva,
Yes.
Council President Armington.
Yes.
Excuse me, ordinance 32-2021 has been introduced properly by title and will be considered further after a public hearing on November 30th. Ordinance number O-33-2021, an ordinance creating a new chapter 24, establishment of cannabis licensing and business regulations, and amending and supplementing chapter 30, land development ordinance of the code of the town of Morristown to establish a zoning code and licensing requirements for permitted cannabis businesses.
I'll make a motion to introduce ordinance number O-33-2021.
I'll second.
Comments or questions from council?
So just want to give a sort of an overview of the process we went through on this. As you all probably recollect, back last year, we had gone through a process of looking into legislation to support the establishment of medical marijuana dispensaries prior to the November 2020 referendum, which approved recreational marijuana in town. We had gone through some of the zoning elements, we'd gone through some of the licensing elements, and then we decided to put a hold on it once we knew that the referendum was coming up, to see how we should address that. Once the voters of New Jersey approved a recreational marijuana as a referendum initiative, the state of New Jersey in February of 2021 put into place their initial licensing regulations, sort of big picture stuff, and we took that and we modified the licensing ordinance, and to add recreational marijuana licenses, we came up with a general framework for an ordinance, and then in April or so, we decided with the administration and the council to broaden the discussion, creating a council committee with members of the public and stakeholders, generally including 2 members of the public from each ward, 2 members of the public designated from the mayor's office, planning department, I think the partnership, and others. And we met 3 times over the late spring, early summer, and hashed out all of the elements from the beginning question of should we allow recreational marijuana in the town of Morristown or medical, and I think overwhelmingly 90% at least of the committee was in favor of it. The underlying issue for me was that of the referendum in 2020, 77% of Morristown residents who voted in that election voted in favor of the public question to support recreational marijuana. Mayor, how are you doing? So we went through each of the elements of the framework ordinance. We talked through the licensing elements, how many licenses would be right, how many, what's wrong. We talked about how much parking should be needed. What do we do about, pedestrian queuing? We talked about, the lessons learned from looking at other dispensaries around the state and around the Northeast. We talked about zoning, where in town it should be permitted or allowed, where it shouldn't be allowed, and all the elements that should be considered so that we can allow residents to have access to the services without or while minimizing any adverse effects that we've seen in any other dispensaries around the state and Northeast. So the ordinance as it stands essentially establishes up to 2 licenses for either medical or recreational marijuana dispensaries, one of which has to start as a medical marijuana dispensary. I believe there are currently no recreational licenses available at the state level. The ordinance establishes a application process for prospective applicants to file with the town, and includes everything from their security plan, their pedestrian queuing plan, traffic management, a number of other things that you clearly their experience. It includes so it provides when there's more than 2 applicants, it establishes a framework for a competitive application process based on established criteria. It sets up a cannabis, I'm not sure what the terminology, but it's basically a committee of representatives of the administration, police department, zoning, mayor's representative, council representative, to review these applications, to consider the validity of each applicant and how their point levels is established. Prior to any competitive application, the ordinance sets as a priority that businesses of minority businesses, women-owned businesses, and disabled veterans-owned businesses are seen as a priority, and that those elements match what the state of New Jersey legislation establishes. The ordinance then proposes changes to the zoning code to allow as a conditional use recreational or medical dispensaries in the town core district and the MX2 district, conditioned upon them being at least 200 feet from all houses of worship and 1,000 feet from any high school, middle school, or elementary school, and at least 1,000 feet apart between the two establishments, if there are 2. What else? The ordinance, as established by state law, essentially taxes the dispensaries at a 2% rate of all sales or transfers within the cannabis dispensary and other distributors. 2% of all sales go to the town, and so we need to figure out if it passes where that, if that should be allocated just to something in particular, possibly the health department. So that essentially is the crutch of the ordinance. If anyone has any questions or comments, I'd appreciate hearing them now. I think we want to, due to the sensitivity of the issue, marijuana has, for as long as I've been on this planet, a controlled substance, and I've heard from a number of constituents really awful stories of how family members have gotten hooked on marijuana, and it has turned into they've turned on to stronger drugs, and it's essentially ruined lives and family lives. And so I'm not absent to that realism, but I also understand that science has now said that cannabis is a significant benefit for medical purposes, and recreational elements for people over 21 is not much worse than alcohol, in my opinion. So those are my words. If anyone else has anything to add.
Council President.
Just to add on, Stefan, to some of the things you said.
Hold on. Mayor Doherty wants to.
No, I'm sorry, Councilman Iannacone. I just want to apologize for being late. It was unavoidable. I could not change what happened, and sorry for being late. That's it.
Bob, go ahead.
Just a few other things. I think your summary of the proposed ordinances was excellent. I think the other thing to stress, though, is consumption on the premises or actually in public spaces is still not permitted, period. So it's a distribution site, solely a distribution site. The other thing I think that you did mention was security, but also the need to limit the hours. So there's a lot of substance in the ordinance limiting the hours of operations, putting parameters around the scope of the operation, including how it can be advertised, how there can be no smoking on site, no sampling on site, there should be no odors. That's very, very important. The other thing I do want to bring up again is again with the comment from the public portion. Is this still is a controlled process by the state in a state that's responding to regulation, a public vote, where 77% of the people in our town wanted access, and I've talked to a lot of people wanted access. I will tell you, there's a flip side to the story, and that is the need to have access to what I'll call clean pot. What we're starting to see a lot in the public is you got a lot of people are gonna smoke, okay, and it's better to control it. There is a lot of stuff out in the streets that is laced. We're seeing it in our healthcare facilities, and it basically, none of us feel really comfortable with this. But one, it is the law. Public is saying, has voted on it. And to deny access, I think, is not the right thing to do.
Thank you, Bob. Yes, Sandy.
Stefan, I have a question. As we know, the zoning board, people go before the zoning board to get variances. This is not going to be any variance granted outside of the zones that we specified, right? Nobody can go to the zoning board and say, well, I'm in MX another zone and be granted the right to a different location after what we reviewed?
What we didn't say was that the license is tied to a particular location. And a transfer of a license is not permitted without the applicant filing a new application. The license cannot be sold to anyone else, similar to a retail consumption license for alcohol. So most of the requirements are tied to the licensing, whereas the zoning, the requirements of the zoning is that it's in the town court, it's in the MX2 district. I don't see any planning board or zoning board granting a variance from the proximity to a school or a house of worship. The school is really regulated by the state, and I think so. I don't, the parking, as we have researched, is the biggest potential nuisance, and so the requirement in the zoning code is that the parking has to be on site. It cannot be off-site, and the number of parking spaces is established. So I don't see an opportunity for much of a, we don't talk about the size of the building. We don't talk about any of those things. Aside from those critical elements, it's a retail store. And so, there's no height or side yard setback or anything else that really is different than a retail store anywhere else in the town. So I don't.
Sandy, finding the site for this was really probably, Stefan, wouldn't you agree? Finding the zoning for this was very, very difficult in town.
Right.
And so you would have to show tremendous amount of benefit to put it in any other zone because of the variance and the weighting of the detriment versus benefits and everything our great planning board and board of adjustments do. It'd be very, very difficult, if not impossible. The one thing it could help, though, is if we did not notice a site, which I don't think we did. I think we looked at every inch of town where this could possibly work, and I don't think it's possible at all that you're going to see it outside of the TC zone.
And Councilor Capel, if I can add, to point out that the zoning requires, it makes it a conditional use.
Yeah.
So any variance from the zoning as prescribed would send it to the zoning board of adjustment, which would be a major barrier towards any kind of approval that doesn't really comply with the ordinance, and that's beyond the local licensing requirements. That would I think it would be a tall order if it doesn't comply with the ordinance as described.
Okay.
And we'll tell you also, and Stefan, you pointed it out, the other benefit of having, when there's a transfer of the license from two different owners, it not only requires the re-review by the town, but it also keeps the price of the license from becoming an asset of the owner, where basically the value of that, like a liquor license or a cab medallion, goes up and up and up. And it's detrimental actually to the consumer. So I think our ordinance, has some wisdom in it, in the extent that we now require that it's almost a franchise, a temporary franchise that they're obtaining. It is not an asset.
All right. So my next question, I think, Jillian, this might be for you. The application, is that per municipality, or is that something that's dictated by the state? Do we have a higher threshold for people to apply, or is the state giving us guidelines on what needs to be in that application? I just don't want somebody to come up with something that we had any kind of discrimination on, the application didn't cover something. So I'm just asking, were there guidelines, or each municipality is up to them to make up their own application process?
So there's really two separate processes that have to happen for somebody to open a dispensary. The first is that they have to get local support, and this ordinance contemplates creating essentially a local business license that would require a potential licensee to demonstrate wherewithal, to select a site that fits all of the zoning criteria, and to be able to operate under all the guidelines that are specified in the ordinance. If there's multiple applications, then it would be a competitive process that the committee would evaluate all the applications and decide what application or set of applications would be the best fit for the town to recommend for the governing body in order to award essentially conditional license, the local license. Then the potential licensee would take that to the state licensing process, which is a lot more rigorous and extensive, as Councilman Iannacone alluded to earlier. That would be a requirement before opening a dispensary. The state requirements are universal across the board. Our local business operating requirements are at the discretion of the governing body, and can be effectuated by ordinance as long as it's consistent with the state guidelines as we believe our ordinance is.
I would also add that our ordinance is a conglomeration of the ordinances from Jersey City, Hoboken, a dozen municipalities around the state that we believe have good ordinances. So I think that Mr. Michello has thoroughly vetted it. The precursor ordinances have been vetted by all their respective attorneys and made determinations that it's not biased towards any individuals.
So are we ready to go with an application right now if the state started issuing licenses in the next few weeks, or we're not at that point yet?
No.
Okay.
So who will be in charge of crafting our application?
Thank you. That was exactly what I was trying to find out.
Actually, Jillian, but if you read the ordinance, it's actually the criteria and the application elements are all outlined in the ordinance itself.
They are. I would expect an RFP process to be developed based on the criteria as laid out in the ordinance. I certainly expect to represent the administration to organize that process on behalf of the selection committee.
And probably reviewed by the attorney.
Of course.
Or certainly.
As
okay.
Always.
I want to go with the question that the member of the public made, because I make the same comment to President. We have 5 people that will be members of the advisory board. So I would like to have a deeper understanding, not only me, but probably many residents too, because I asked if we could have, instead of 5, 7, and maybe one will be from the health portion of our town, a doctor, and maybe one from education. Even though the understanding is that as they review that, the application has to fulfill all the rules and regulation of the ordinance. But I think having people from those fields will be more confidence to the residents. So anybody?
Well, I could say I don't really agree, because again, this is a zoning, this is to apply. It's not for the use or who's qualified to buy it or who's qualified to get a medical marijuana card. A doctor has no really say, doesn't really add anything to this list of 5 people, because they're not, this is really a business list and a zoning list. So it's like, why would a doctor have anything to say? It's not like they're giving an applicant for a medical marijuana card. This is a business license they're applying for. It's all business.
Yeah, I agree, Sandy. And, you know, the other reality is this, is when you take it to the level where you're not just looking at an application from an administrative process and you bring in judgment into the process, those are the kind of items that would necessarily go to the board or some kind of board or commission to review. That's not this kind of application. This is an application that's looking for the compliance with an ordinance. And the judgment of the doctor or judgment of an educator doesn't really apply in that instances. And in fact, what it could introduce to the process is some prejudice, some points of view outside of the four corners of the ordinance. So that's why I would disagree with that. However, I think you bring up another good point, which is what is the role of a doctor when you're talking about cannabis? What is the role of an educator when you're talking about cannabis? And just like what Stefan was saying, where there's a lot of hesitancy in the public about access and this becoming a stepping stone drug, so to speak, that's where the resources should be. The resources should be in education. Now, the town will be making some money off of this. There is, by state ordinance, there's a percentage of the sales that is taxed that actually goes to the town. How we use that money is up to us. We have a lot of programs in town. We have a lot of programs in the school district. We have a lot of programs that are actually operated by our own law enforcement agencies here in town that do education on drug and alcohol. And I think your concern may lend itself more towards that channel than the channel of developing an application to basically process pursuant to an ordinance. Just my thoughts.
Yes, for many people, when we deal with situations and issues like this one, money is not the first issue. It's not the top of the line concern. We know that it's going to be a revenue, but perhaps protecting our youth. I'm going to speak from my own experience, 27 years as a minister and helping people getting out of alcoholism and other addictions. And as one of you have said, many people went from marijuana to hard drugs. And I know and I understand the resolution is very tight and it has a lot of measures that will help us to control that. But what I see, for example, on the application qualifications, there is by percentages on different categories. And some of those categories are very technical because it's like for medical, they have to fulfill certain criteria. And I don't know if every single member of these 5 are qualified or expert on those criterias. And I think one of the criteria at least has to do with finding out that the person that is going to get the license is really qualified, like a pharmacist to sell drugs, to medicine, I say. So that's why I asked the question and gave that opinion. Maybe also Mr. Minchello can enlighten us on legal aspect of that.
Well, thank you, Councilman. I'll happily address that. I would strongly recommend that the advisory board remain either elected officials or employees of the town. The actions that the board takes or the recommendations made could be subject to review by a court. Individuals who are denied licenses may, in fact, want to appeal those decisions. As legal counsel, I have the ability to advise both elected officials and employees with regard to the actions we take. If we include other members of the public, the process could get away from us, and the legal advice that I could give to that board could be compromised. So my recommendation is that this is essentially a licensing function, and it should remain with the elected officials. You are elected, obviously, to represent your constituency, and also with the employees. And as has previously been stated, we're only looking at it on the criteria that is set forth in the ordinance. So as Councilman Iannacone said, we look at it under that, it's not a judgment call. We're looking to make sure that there's compliance with the ordinance. So my recommendation is that the members that have been proposed tonight should be the members of the advisory board going forward.
Thank you, David. Just David, not you, David, Silva. Just to let you know the progression here. Originally, it's the action, the review action was by Jillian and Margot acting as essentially the historical the representatives who have essentially granted or provided approvals for all of the other town licenses in town, and I think that the effort to widen that to share the load, if it's not anything else, is understood, and so that's just the history of how this has gotten to where we are at 5 people as opposed to just Margot and Jillian.
It also wasn't just to lighten their load, though. It was to make it less arbitrary. So it wasn't one person deciding a monumental decision of who gets an application approved and who doesn't. So to take it off of one person and then have that one person be the target if somebody doesn't agree with an appeal or being turned down, it is now in the hands of 5 people reviewing an application, given their 5 different points of view. When you have the business administrator, chief of police, director of law, town council designee, and mayor or designee, it's coming from 5 different locations, how they look at an application, and it's a lot less arbitrary to me. And when you have a lot of people giving their opinion, 7 starts to muddy the waters, and 1 probably isn't sufficient to be non-biased. So this leaves it to be a non-biased group of 5 people looking at applications, making a decision. That's just my opinion.
And to Mr. Mancello's point, it is not fun to, even as an elected official, to be the subject of a lawsuit by an aggrieved license holder, even though you hope that you're covered by the town. So.
There is another just question / comment, and what I make these comments or questions is more so the residents will have total clarity, especially those that are heavily concerned. So during the process will be that they can obtain the functioning license with us for the town, but it's conditioned for them to obtain the state license to operate. Is that correct?
That's correct.
So if, let's say, we finish the process and they apply, or somebody applies and obtains our license, and if they don't have yet the state license, is that a possibility, and what will be the outcome of that?
I believe the ordinance, and correct me, Jillian or David, the ordinance basically says that once the licensee has obtained the municipal license, conditioned upon receiving the state license, the licensee has 12 months to obtain the state license, which can be extended for another 6 months for cause by the council, granted by the council. And so after 18 months, if they have not yet received the license, then that application is voided, and the application or the competitive application starts all over again.
Would it be better if the applicant, one of the conditions for the applicant was that he or she already had the state license? I see, a proper order there. First the state and then us. Not obtaining us and then see if they're going to obtain state.
I believe the state license is tied directly to a property. So the state will not grant a license unless the applicant has a property which they have obtained and subsequently a municipal approval for that license. So essentially we're granting them a letter of support for the license conditioned upon them granting receiving a state license. Besides the 18 months duration, it provides them no benefit, no ability to sell that license, transfer the license if they're not able to acquire a state license.
So Stefan, if we all know how quickly the state moves on things. Sorry. We don't know how fast they're going to move on any licenses. Is there a chance that we could issue a license and the state is not even moving in 18 months? Will we address that if that becomes the norm? Or are we just going to play it out for now? Because we don't know. We have no idea how this is going to work with the state because it's all new. Go ahead.
I believe.
Let me put a question to David, because just to point this point, and actually it's going to be more than likely, Pastor Silver, that the applicant will probably have the license even before they come. And even if they come with the license, it doesn't mean it necessarily comes to this town. Okay, we don't know how the state is actually going to be distributing these licenses. It may be that they come and they talk to us first, okay, and we basically say, yes, you're compliant. But at the end of the day, for them to actually be able to come into town with this business, they're going to have that state license. And also, we don't know how yet the state is going to be distributing these licenses. You know, are they going to be doing it regionally? What are they going to be doing? We don't know. Let's be very clear what we're doing here. If this is almost like a defensive move by us, that's how it started. If you remember back, we actually banned, we still have a ban in place until we got this zoning ordinance in place, because we did want to control where they were going to be located, and we wanted to control how they were going to operate. But as far as the licensing is concerned, it's almost exclusively with the state. It's going to be almost exclusively, it is exclusively with the state. And the medical decisions, the competency issues, experience and what have you, is really what's outlined in the state rules and regulations. And it really is going to be left, a lot of that's going to be left to the states and the state's authorities' licensing standards.
If I could, Council President, if I could just clarify, just so we all understand our process. The process will begin, in order to receive a state license, the state is going to look to the applicant and say, do you have the approval from the local municipality? The only way in which they will have that approval is if they go through our application process locally. So the process will begin with us, but it certainly will not end with us. The state will ultimately make that decision in that 18-month period, hopefully, at which time they will come back, and now they will be, once they have the state approval, they will have already had the local approval and can move forward. So it will, just to clarify that so we all understand what we're talking about, the approval that comes from the local municipality will come through our application process.
But David, just to clarify further, we can really only judge the applications, and this is a very, very valid concern of Pastor Silver. We can only judge this application as it relates to zoning and operations. The deep dive into an operator, we cannot take responsibility for that. And we shouldn't put that burden on the state. The actual capability, credibility, and capacity of an operator really is being left to the state. That is not something that we should be judging applications by.
So Bob, you're saying
You're
that
100%
we
correct.
could have somebody, that's correct. So we could have somebody apply, go through the whole process, pay the application fee, and then have the state turn them down.
Mm-hmm.
Yep.
Okay, well, that's very good to know. Thank you.
Mm-hmm.
Can an applicant apply to more than one municipality on the hopes of getting one state application, one state license, and then, I mean, he'd be tied to a lease, but if he did that, could he then pick the municipality he wanted to go to? Or would the state frown on that?
I think they could do that. However, at least in our ordinance, you have to have
A lease.
substantial control over the property. You can't just be a tenant. You need the approval of the landowner through a contract or some sort of long-term lease agreement that the landowner agrees for you to use that property. So if you're not going to get that if you're shopping around, I think. But who knows?
All right. Very interesting. Thank you for the information.
If there's no further questions, I'd call the vote.
Okay, on the introduction of ordinance 33-2021, Councilwoman Cotton,
Yes.
Councilwoman Foster,
Yes.
Councilman Iannacone,
Yes.
Councilman Mayor,
Yes.
Councilman Silva,
Yes.
Council President Armington.
Yes.
Ordinance O-33-2021 has been introduced properly by title. It is scheduled for further consideration on December 14th after a planning board consistency review on December 2nd. There are two ordinances for public hearing and adoption. Ordinance number O-30-2021, an ordinance of the town of Morristown and the county of Morris, state of New Jersey, establishing compensation for certain officers and employees of the town of Morristown.
I'll make a motion to adopt ordinance number O-30-2021.
I'll second.
At this time, I will open the floor for public hearing on ordinance O-30-2021 only.
I don't see any hands raised for public comment.
I'll close the public comment period on ordinance number O-30-2021.
Any comments or questions from council? On the adoption of ordinance O-30-2021, Councilwoman Cotton,
Yes.
Councilwoman Foster,
Yes.
Councilman Iannacone,
Yes.
Councilman Mayor,
Yes.
Councilman Silva,
Yes.
Council President Armington.
Yes.
Ordinance O-30-2021 is adopted. Ordinance number O-31-2021, an ordinance amending and supplementing the code of the town of Morristown, Chapter 7 Traffic, Section 7-40.2, handicap parking on streets for private residences, to amend the placard number assigned to a dedicated parking space for a resident of Columbus Street.
I'll make a motion to adopt ordinance number O-31-2021.
I'll second.
Okay, I will open the floor for a public hearing on ordinance O-31-2021 only.
That's why I don't see any hands raised for public comment.
Close the public comment period on ordinance number O-31-2021.
Any comments or questions from council? On the adoption of ordinance O-31-2021, Councilwoman Cotton,
Yes.
Councilwoman Foster,
Yes.
Councilman Iannacone,
Yes.
Councilwoman Mayor,
Yes.
Councilman Silva,
Yes.
Council President Armington.
Yes.
Ordinance 31-2021 is adopted. There are two ordinances on the agenda for adoption. Would any council member like to consider them separately? If not, I would ask for a motion to.
Or you meant resolution, correct?
Margo, can you pull 174?
We'll just do all
Separately, that's right.
They're separate.
Okay, resolution number R-174-2021, resolution approving the best practices inventory and authorizing the town clerk to complete the best practices public meeting certification form.
I'll make a motion to adopt resolution R-174-2021.
I'll second.
Councilman Iannacone?
Jillian, is this to file the application, or did you already get the score already?
This is to affirm the best practices inventory. It was filed last week.
Perfect. And your score, it was 19.5?
That sounds right.
Well, actually, you should just let this go by. Tell people about it. Congratulations to the administration. This is great.
Thank you.
I mean, tell people about it. What's it about?
Yes.
What's the highest score?
23.
23. Wow.
Mm. You're gonna basically 100%, which actually ensures that we're gonna get the state aid. I
That's
mean,
great.
congratulations to the mayor, you guys did a great job.
Thank you.
Thanks
there'll
to
be some
Martha,
state aid
she's
to
the one who
talk about.
completed this.
No, I didn't.
All right, call the question?
Okay, on the adoption of resolution R 174, 2021, Councilwoman Cotton,
Yes.
Councilwoman Foster,
Yes.
Councilman Iannacone,
Yes,
Councilman Mayor,
Yes,
Councilman Silva,
Yes.
Council President Armington.
Yes.
Resolution is adopted. Resolution R-175, 2021, resolution authorizing appropriations transfer between 2021 budget appropriations.
I'll make a motion to adopt resolution R 175, 2021.
I'll second.
Any discussion on the adoption of resolution 175-2021? Councilwoman Cotton,
Yes.
Councilman Foster,
Yes.
Councilman Iannacone,
yes,
Councilman Mayor,
yes,
Councilman Silva,
Yes.
Council President Armington.
Yes.
Resolution is adopted.
All right, that concludes the regular business. We have one point of unfinished business, in-person meetings. Included in your packet, after the last meeting, I'd asked Margot to reach out to her clerk colleagues in the county. I'm not sure how many towns are in the county, but she was able to get hold of 32 of them. Of the 32 towns, 4 of the towns, including Morristown, still have remote meetings only. The other 28 either have in-person meetings or in-person and hybrid meetings. So I think this shows that, at least from our perspective, we're more secluded than the rest of the county. But I know that there was supposed to be a hybrid test. Wondering if that was successful or not.
Yes, Council President, we were finally able to have a successful hybrid meeting where everything seemed to work as intended. We'll have to monitor for feedback, and Hanfeld, who's our AV company, I think we'll be bringing an extra staff person to monitor the sound system as the meeting is going. It will be a couple more things for Margot and myself to do during the meeting, but I'm hopeful that we will be able to successfully hold a hybrid meeting. I'll keep my fingers crossed when we decide to go forward.
Do you have any thoughts of when that might be?
I can certainly leave it to your discretion.
Why don't we, since the next meeting is right before Thanksgiving, and then the following meeting is the public hearing for this cannabis dispensary, which I would expect would be of interest to people. If we can hope to go back to a hybrid session for is that the December 14th meeting? Would that work for?
We have a council meeting on Tuesday, November 30th.
after
Okay.
Thanksgiving.
And then the last scheduled council meeting of the year is December 14th.
that's fine. Why don't we shoot for the 30th, and if it doesn't happen on the 30th, we'll have it the next week. And who knows, it may go wrong on the 30th, and
Okay, that sounds good. Is the rest of the council in favor of that?
So we will have the hybrid on the November 30th.
That's the intent.
Okay.
We'll be in
Yes.
What
chambers.
is that gonna look like? I mean, can you explain the hybrid for us anyway? What's that gonna look like?
Sure. So the hybrid setup would have the council members in person in council chambers, as you normally would be. But we would also have the meeting simulcast through Zoom. It would be, the Zoom feed would be camera 3, which is the back of the council chambers. And then participants would be able to join the Zoom meetings like they have been doing. and we would be able to take public comment through Zoom. It would be heard over the audio system in council chambers, and you'll be able to hear them, and they'll be able to hear you. And then we'll have the Zoom meeting feed on the television screens, or the projector screens in council chambers. So you'll be able to see the Zoom meetings in council chambers, and any public, member of the public that attends in person. We would also have the, in-person public comment period, and the microphone stand set up for in-person public comments.
Has there been any consideration of plexiglass or limiting access to the front row, or moving the DAs back or anything like that?
Yeah, so we would also, to require social distancing, we would limit access to the first pew, and every other pew would be roped off to ensure that there's social distancing amongst people who are attending in person. If you remember, I know it's been quite a while, but the public comment microphones usually kind of in the front. We're going to move that back to line up with the first pew, so that the public speaker will be sort of away from the dais, and we'll have disposable microphone covers to sort of further ensure some sanitization of the equipment. And then council chambers will be sanitized before and after the meeting.
And I assume the town halls remains to have the mask mandate for town hall. Is that still in place, or?
So the mask requirement is still in place for town hall. However, if a member of the public chooses to attend the meeting without their mask, we cannot bar them from participating.
Okay. What is the intent for council members in terms of masking and while they're speaking and not speaking? Do you have any sort of best practices from that perspective?
Certainly, the most cautious would require everyone to be masked. However, if you are all vaccinated, then social distancing is not necessary, and I would leave that to your individual discretion.
Okay. All right. Sounds like a plan moving forward. Appreciate all your help. If any new business, any other business council wants to bring up? No, I ask for a motion to adjourn.
I'll make a motion to adjourn.
Second.
All in favor?
Aye.
Aye.
What's the other option? Against? Meeting is adjourned.
Thank you very much.
Thank you.
Thank you.
Bye.
Good night, all.
Aye.
Happy Thanksgiving.